You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. We're talking about dental implants to replace missing teeth. With us, we have an expert on the topic, Dr. Phillips. Dr. Phillips, welcome to the program.
Thank you for having me.
Now, for people who don't know your practice, I guess you have a very large practice where you are. Who's your typical patient, and what are the different procedures that you do?
You know, Randy, our typical patient is pretty much everybody. We see young adults, people middle-aged, people that are 60, 70, 80 years old.
Okay.
And older.
And what are the different procedures you do?
The procedures that we do are fillings, cleanings. We do take teeth out. We do crown and bridge dentistry. We also do dental implants. We do dentures. We do laser gum therapy. We do laser teeth whitening. We do Botox, Juvederm. Okay. There's a lot of things that we offer.
So dental implants
yes.
is what we invite you on the program
right.
Today. So what are the different categories of dental implant patients that you see?
Well, you have different types of patients. Some patients don't have any teeth at all. Some patients may be missing a few teeth, and then some patients may be missing one tooth, and they need to know their options for replacing that missing tooth.
Now, we said at the top of the show, no more dentures. Do you believe that? I mean, that's the future of dentistry?
You know, I do believe that. Now, you have to realize within my practice, not very far, there's probably tens of thousands of patients that are wearing dentures right now.
Really?
And yes, and with dental implants, Randy, we can lock those dentures in and take away their movement and really increase the quality of their life.
Now, you say with as little as like 2 dental implants,
That's right.
You could give somebody a full arch of teeth that snaps in, snaps out.
That's right.
If it's such a good program, and you say tens of thousands of people have an upper or lower denture.
That's right, they do.
Why aren't they all doing it?
Well, I don't think they know about it. And I feel like that once you get dentures, you think that that's it. You might feel like that's what you're stuck with for the rest of your life, and that simply isn't true. Sometimes patients will go around and they'll hide their smile or they won't be self-confident, and with implants, it locks those dentures in place, and then they can eat and they can chew. Their quality of life is much better, and I think if anyone could get them, I've never had a patient tell me they wish they would not have gotten these.
You say it's life-changing.
Yeah, it is life-changing. It is. There's no question. Patients tell me all the time. I had a lady, she was 76 years old, been a denture wearer, Randy, for 30 years. And when we hooked her up to her implants, she came in and she brought me a big pie and she gave me a big hug. And you know what she told me? She said, Dr. Phillips, for the first time ever, I'm able to eat lettuce and chew it properly. Little things that you and we take for granted. And here she is, she's able to eat the stuff that we don't really think about. Lettuce, carrots, broccoli, and she's able to chew it up properly.
How old can you be to qualify for a dental implant?
Oh, there is no age. There is no age at all. You know, my oldest patient's 88 years old, and she wanted to be able to chew. So we did implants. And
aren't they more likely to fall out, though, if you're that age?
No, Randy, they're not. And the reason they're not is studies show once the bone fuses to that dental implant, it has no age barrier. Once that implant is in there, it's in there, and we consider it a lifelong restoration.
What about pain? I mean, it does seem very painful.
And that's what patients ask me about all the time.
On the consult, they all want to know about that.
They want to know, but you got to realize that your jawbone has no nerves to it, no feeling, so it's only the gum tissue. So once the implant is placed into the bone and the bone fuses or grows around it, then we no longer have to worry about pain. I have patients that tell me, I expected this to hurt. And yeah, they were a little bit sore, but they did not have any pain compared to what they had expected. In fact, I had a patient who was sedated. We did all of her dentistry with implants. She went home and woke up later on and told her husband, she said, I missed my appointment. She didn't even realize that she had
What, no memory of the...
Very little to no memory when we sedate our patients, and that's the beauty of it. Patients want to have great experiences.
So because you do sedation,
yes,
right? I mean, you're kind of known, I guess, in your area as the very complex,
right,
the dentist of kind of last resort.
That's right.
Is that right?
That's right. We have other doctors in other surrounding communities, and they refer their patients to me. Those patients that are high fear patients, haven't been to the dentist in 5 to 10 to 20 years, they'll send those patients to me, and we'll sedate them, and we will take care of them. We'll give them the smile that they deserve, the smile they've always dreamed of.
Okay, good. Now you brought some photos.
Yes.
What are we going to look at here?
Well,
And these are all dental implant?
these are all my patients.
Okay.
And these are all dental implant patients.
All
Okay.
right.
Now, here's a patient, and this patient comes to me, and she's saying, you know, I don't think my teeth can be saved. She's been told by other offices, other doctors, that her teeth cannot be saved.
Okay.
And she does not want dentures. And she's had a lot of pain. She's had a lot of problems. And Randy, she's embarrassed to smile. Her and her husband.
Like she looks like she's a smiley person in this photo.
Because I asked her to smile as big as she could. I had to ask her to force a smile.
Okay.
She does not want to smile. She had trained herself when she talked to her employees to hold her hand up in front of her face. She was so self-conscious of her smile. And let me tell you, we did implants on her, and we gave her a full set of teeth on the top and the bottom, and it is absolutely
Wow.
amazing.
That's a smile makeover. That looks good.
Yeah, yes, that is. We gave her a brand new smile. We gave her her self-confidence back, and she looks fabulous. And Randy, let me tell you, she told me that her husband now has to tell her to quit talking as much because she's so full of self-confidence. That smile before, that was keeping her bottled up, and she no longer has to do that anymore. She
So
said,
the husband tells you she won't stop talking now.
well, yes, but you got to realize as a business owner, that's what she has to do.
Yeah,
and
yeah,
before he had to get her to talk because she wouldn't
Okay.
talk. And now it's like, man, she you know what she told me? She said, when you fix the beauty on the outside, this came from her, when you fix the beauty on the outside, you feel better about the inside. And the inside is what matters. And her smile before, Randy, her smile before was keeping her all tucked in. And now we can just
Well,
release that.
she looks obviously more attractive.
Yes, yes.
Just because of the smile.
Well, and she laughed the other day, and she told me a story. She said that her and her daughter were out, and someone asked if they were sisters. You know, so yes, she looks a lot better. But if you look at her smile on the after picture, and you look at her eyes, you can just see her self-confidence. I mean, she feels so much better about herself, and that's what we can do.
Are there a lot of people like her that, like, their teeth have to go and they do nothing for a long period of time?
Absolutely. And there's a lot of people that their teeth have to go and they give up. They throw in the towel and they're not going to do anything else, and they're just going to let it, I mean, it's like they're putting their life on hold. And then they come to us and they realize we can help them.
Is this one of those things like a woman like this that says, I should have done this years ago?
Absolutely. Absolutely. Why would you wait? And they all tell me, they say, you know what, I wish I would have done it 5 years ago or 10 years ago. I thought there was going to be a lot of pain involved. I thought there was going to be it's going to take a long period of time, and that just isn't true.
When you get dental implants, like, what can you eat?
Well, this patient, she can eat anything, literally. A corn on the cob, she can bite into an apple. A raw carrot, she can bite into a raw carrot. The advanced foods that's hard to eat, she can tackle them just fine. Let me show you another patient.
Okay.
Okay, this is a patient, and she comes to me,
Oh my goodness.
and she's 78 years old, and she wants something fixed. Now, when you
Now
look
that's
at,
got to be unusual, by the way.
no, it's might be unusual to you, but it's not unusual to me, because these patients hide their smile, and they're going around. You know, people like this right now that come in
Really?
contact with you, and they never show you that. But there's people like that all over. It's not uncommon for me. These people come in and they feel like their mouth is the only mouth. They say, I'm sure my mouth is the worst mouth you've ever seen. And
They
that's
say
not
that?
true. They say that all the time. So she comes in and she has all kinds of dental problems. There's no way she can chew. Okay? She won't smile. She has infection. She has broken down teeth, worn teeth. Now look at this. Look at this smile, Randy. This is a smile that I forced her to do. This is the biggest smile she would give me.
Okay.
Okay? And when you look at her after picture, we literally changed her life.
Wow.
Now look at that. Now look at her smile. Look how easy it is for her lips to come up. And when you look at her eyes tell the story. She's not afraid to smile anymore. She's not afraid of self-confidence. Now, Randy, this is a lady in her late 70s, and she plays golf every day. She's very active.
Okay.
Okay. People today, they want to be active for their whole life, and they want to be able to chew. And chewing gives you, the ability to stay active longer.
So what did you do for her? Like, how many dental implants to give her that?
We
Full
did
set of
implants.
teeth.
We did implants on the bottom. We did implants on the top, and she has dentures that snap in and out.
Okay.
Okay?
So no adhesive, nothing
Oh, no
like
adhesive. They don't move around. They lock in place.
that. And she could eat whatever she wants?
She can eat whatever she wants.
So you know her now? You run into her on the golf course?
You know, I don't run into her on the golf course, but she's a family member now. Once
Do they tell you what they eat?
Absolutely.
Can she eat whatever?
Whatever she wants. She can eat whatever she wants. It doesn't matter. Okay?
Interesting. So the dentures, you say there's tens of thousands of people where you live, in the area where you live, that have dentures. Okay?
Yes.
So you think it's their fear of the dentist? Why they're not? I mean, if dental implants are so good,
Right.
is it just because they don't go to the dentist and nobody's telling them to do it?
Well, some of
Is it the money?
Some of it could be the fear, but some of them don't know, and that's why we're doing this, because
Okay.
I want to get the word out. Some people have been wearing dentures for so long they think that they're stuck, and that a denture that floats around sitting on the gum tissue that moves all the time, or they have to glue in with sticky adhesive, you know, they think that's all they have.
But isn't it true though that if you've been wearing dentures for like 30 years, that you don't have enough bone? Oftentimes.
Well, it is true that if you've been a denture wearer for a long period of time, you'll have less bone. But more times than not, and most of the time, I've had patients that have come to me from other places, and they said they couldn't do implants on them, and we were able to get them in.
So some people can walk in, you say, without teeth, and walk out with teeth.
That happens, no question. They walk in, we get the implants placed, then when we hook them up, it is life-changing for them.
Now, in your practice, here's another thing, and I'm not trying to side with you too much. I'm just, in fact, people need to know it's a real interview, and I'm not endorsing you on this.
Right.
I'm just asking the questions. But how it's normally done, correct me if I'm wrong, is if you go in for dental implants, you go to one place, which is the surgeon does the dental implants. Then you go to another place, which is the dentist that puts the teeth on top, and you may go somewhere else for the imaging.
That's right.
But you do it kind of all under one roof.
We have the training.
So you have both.
Yes, we have the
Parts of
training.
training.
We're able to do all of it in one roof. And I think that's why our patients like coming to us, because we're a sedation office. We can sedate them and make them very comfortable. And then because we're a sedation office, we have to do it all, because these patients aren't going to go anywhere else.
So you do a lot of sedation.
We do a lot
Like
of
every
sedation.
day you do sedation?
Every day we do sedation. We've been a sedation practice since 1998, and because of that, we're very well known. And with other doctors referring their patients to us, Randy, not a day goes by we're not sedating a patient.
Safe?
Extremely safe. Very safe.
Now, what about making them look real? Because I always feel like I could spot a denture walking toward me,
Well,
or veneers or whatever.
That's right, but you can't spot one of my dentures, because there's a lot of artistic expression that goes into it. If you would, pull up those pictures again.
Okay, this woman.
Yes.
Okay.
Look how beautiful her smile is. Look how natural it is, but it's not perfect. Okay? Perfect is like a white picket fence, and that's what a denture is.
Okay.
And we are not that. Okay? We take into account the patient's, their face, whether they have a long skinny face or a short round face. All that goes into consideration when giving them their new beautiful smile.
What if your gums are bad, though? That means that, somebody there, like you said, they haven't been to the dentist in 15, 20 years. What if their gums are too bad? They have gum disease.
Yeah.
Can you give those people dental implants?
Absolutely.
Are they a candidate?
Yes, they are, because a lot of people are afraid, because of the infection that they have, that there's no way they can get dental implants, and that's not true. Because, Randy, once the tooth is removed, and
We're talking about the bad tooth.
Once the bad tooth is removed, the gum tissue heals up, there's no sign of infection, the infection goes away.
Okay.
Okay? So once the teeth are gone, you are a candidate for dental implants.
So for the denture wearer, when they come in, what are the various options? Like on the consult, what do you tell them?
Well, on the consult, what we do is we ask the patient, what are your goals for your mouth? And we want to hear what they have to say.
Okay.
So for example, somebody might be just wanting some stability, and with two implants on the bottom, we can give them dentures that snap in, snap out. I saw a gentleman a few years back, and he only had enough room for implants up front. So we did 2 implants up front, we snapped them in. He had been a denture wearer for 40 years. And you talk about a quality of life difference for him. He was able to eat things he said I couldn't eat in years. He had a lower denture that didn't move around now. Huge, huge improvement on the quality of his life.
So that's affordable. That's the affordable first step
That's
option.
a great step. That is a great step, and it is very affordable. Then the next step would be to do 4 implants. And with 4 implants, the denture still snaps in and snaps out. Much more stable. It's a better denture. It's a better treatment option. And when we're done, those patients can eat anything they want with absolutely no movement at all. There's a patient that comes to mind, and when we hooked her up for the first time, she was doing this, and she could not believe that they didn't move. The next time she came in, she just would not quit giving me a hug. She said, "You've changed my life. You've absolutely changed my life."
Good.
She told me she thought that she was stuck. She did not realize it was going to be as good as it actually was. So if we were to do implants on the top, if we do 4 implants on the upper and give you a denture that snaps in and out, here's the beauty of it.
Okay.
On that upper denture, we can remove the palate, so there's no plastic covering the patient's roof of their mouth. So they can taste foods, speaking's easier, they don't have to worry about how their food goes down their mouth, they don't have to worry about a denture in the back of their throat. It is life-changing for these people. They've hated that upper denture for years, and to do 4 implants on top and a denture that snaps in, it is a game changer for these people.
If somebody, like, let's say you know, like when you buy a car, if you know, you drive a car for a week and you know, now you love the car. I mean, if there was like a try-in period for denture wearers, because you say there's tens of thousands of denture wearers,
right?
And you say they just don't know how good it can be,
and they don't know, and you can't try it before you buy it.
But if you could, do you think anybody could go back?
But if you could, nobody would go back. I'm convinced of that because I've done too many implants on too many patients. It is life-changing for these people. If there was some way I could fast forward the clock and say, here, this is what it's going to be like when we're done, do you want it? Every one of them would say yes.
Do you think some people, like you mentioned, that there's the denture crowd that needs to come in?
That's right.
But the people that are, you know, their mouth is really a mess.
That's right.
But a lot of people are like embarrassed to go in. They may have the money, but they're embarrassed to show you how bad things are. Are there a lot of people embarrassed?
There are a lot of people like that. And some of these people, it's been 5, 7, 10, 15 years since they've been in. And they think their mouth is a wreck. And it's what we see every day, but it's not what they see every day. And when these people come in, we don't judge them. We don't put them down. We're here to help them. And that's what we do. I am going to treat you like a family member when you come in. And we're going to take great care of you. And we're going to help you reverse the hands of time, so that you no longer have to be embarrassed, have to live every day in pain. You no longer have to worry about what other people think of you or how they judge you because of your smile or because of your bad breath or because of infection in your mouth. I'm very passionate about this.
Good. I mean, you were meant to do this, you think?
Yeah, this is, at age 12, I was in a bad motorcycle wreck. And from then on, I've been fascinated with teeth.
Really?
Messed up my whole face at 12 years old. And since then, I have committed, you know, since dental school, I mean, it's what I'm supposed to do. There's no question, and I love it.
But dental implants, you think, have made the biggest difference in your practice?
Absolutely, absolutely. Without question, we help people every day. And when we do it with dental implants, it is life-changing. Everything we do is good, but not as good as implants. I mean, you can take someone who is a cripple. They're walking around as a dental cripple. They're chewing their food and that denture is moving all around. And we do implants on them, and we stabilize their bite, stabilize their chewing surfaces. We give them something that they don't have to worry about laughing, coughing, sneezing. You know, playing golf, driving, you know, hitting a golf ball on the first tee. They don't have to worry about that. Does that make sense?
And they really worry about that?
Well,
some of these people that are wearing dentures, I mean, that they're going to fall
out. And they'll
out.
never tell you about it.
But yes, they tell you.
Yes, they're worried about that stuff.
And dating or whatever, obviously, it's got to be pretty tough if you...
How many people have come in and told me, my husband or my wife have never and will never see me without teeth? It happens to me all the time. This is a big deal, Randy. Okay, we are changing people's lives. We're giving them their self-confidence back, all with dental implants.
So when you're with a patient,
yes,
because right? You know, I'm picking up on your personality. You're a pretty enthusiastic guy. Like, I mean, do you ever, knowing that you can help them, I mean, do you ever have to think like, I don't want to sound too salesy here, but this is going to be great? I mean, do you ever get like, because you know it's going to be so good?
And it's hard because I never need to want the treatment more than my patient does. Okay. My patient has to want to get it done.
Okay.
And we're there to take care of them. But if they perceive me wanting to do it more than them, that's not our style. Our style is, how can I help you? And with dental implants, I can really help you. And I get really excited. And I can show you before and after pictures of lots of patients. I can even get you on the phone to some people that have given me permission, and you can call some patients we've worked on.
You have a very nice website, by the way.
Well, thank you.
I mean, there's photos on there.
Lots of before and after photos, yes.
Is that how many people find you?
You know, I saw a guy just the other day. And I said, let me get you some pictures. I'm going to show you what all we can do. And this is what he tells me. He says, oh, no. I've already been on your website. I've looked at all your before and after pictures. I know that you know what to do. And that was enough.
And on the consult, are there frequently asked questions? Like, what do they mostly ask? Just,
Well, probably the number one question is how long and will it hurt? Okay, so how long will this take? A lot of times.
Yeah, in a perfect world, what is somebody watching it right now?
Yes.
They're a denture wearer.
They're a denture wearer.
Everything works out fine. Could they have like a full set of teeth? What in how long?
They can have a full set of teeth in as little as 1 to 2 months. No longer takes 6 months to a year.
Okay.
We can do this very quickly. Okay, and that's going to be a custom, tailor-made set of teeth just for that person that will be absolutely drop dead gorgeous.
Now, what about a fixed set of teeth? People want something that doesn't come in and out.
Well, the nice thing about a fixed set of teeth, and we do this all the time, Randy, is we can do some implants, and then we can do a denture that is screw retained. It's called a hybrid denture. Now that denture never comes out. Once a year the patient will come in and get their teeth cleaned, and then the second time they'll come in and we'll remove it and clean it all up and put it back in, but it's screw retained, never comes out. They treat it like their own teeth, and it is awesome.
So do they stain?
No, they don't
So
stain.
just brush them just like
They
regular?
just brush them, floss them, water pick. We always
Flossing them too?
They can floss around them, absolutely. But
Okay.
you got to realize, Randy, this is what people want. They want to have permanent teeth back, and we can do that for them today. With the technology that we have, we can give them permanent teeth that never come out. You talk about security, it is awesome.
And they can eat whatever they want.
They can eat whatever they want. They can chew whatever they want.
And are they ever left without teeth?
Not in my practice. You'll never go without teeth in our practice.
Now, in certain cases, some people could go in with, I mean, you could do things very quickly, like for a few teeth. They can go in.
Yes.
Tell me about that.
So if someone comes in and they're missing a few teeth, we can put some implants in right then and put maybe crowns on top of them and give them permanent teeth versus doing like a dental bridge, something that you have to shave down the adjacent teeth. Sometimes those teeth that you shave down are healthy teeth. So we don't want to do that. We want to leave the healthy teeth alone, place a dental implant, put a crown on top of it, and the implant is like, Randy, it's like the root part of the tooth, and then the crown goes on top of it.
So Medicare does not cover dental implants or insurance here in the U.S.?
No, but we have different types of outside financing.
Okay.
So just like you're going to buy a car and finance that, this is things that will change your life
All right.
for the next 5, 10, 20 years. This is a great investment that our patients make in themselves, and it changes them.
How important is the smile? Now, you're a dentist. You probably think it's important.
Well, of course, I think it's important, but I'm going to tell you, my patients think it's important too. Okay, a smile is the #1 business success rate you can have. Okay, I have patients come to me all the time and they say, before you fixed my mouth, people judged me. They judged me by my smile, and now they don't anymore.
Interesting.
Interesting. Let me show you a picture.
Okay.
Okay, I got to show you this because here's a gentleman that came to me
goodness.
and he tells me that he never ever smiled before, but he told me that he felt like people judged him because of his smile. He had a lot of dental problems. His bite was collapsed. He was missing a lot of teeth. He had a lot of broken teeth. Let me tell you something. When I fixed his mouth, his personality came out. To this day, at least once, if not twice a year, him and his wife will bring food for my entire office. We have over 30 employees, and they will bring 5 or 6 crock pots full of food. They are so thankful. I don't care what I charged him, it wasn't enough, because that's what he feels.
Okay.
He's told me that. He said, you can't put a price on this. He said, people don't look at me. People don't judge me anymore. I don't have to worry about smiling. So you think there's not power in a smile?
Good.
You're crazy. There is power in a smile. It is life-changing. Put those side by side.
Okay.
Because when you look at them, if you look at someone going for a job interview, when
Yeah.
you look at someone in the workplace, who are you going to promote? Now, his smile afterwards is absolutely beautiful, and he's still learning how to smile. You understand?
Yeah. Oh, so that's like a bit of a forced smile.
Well, it's an awesome smile, but it's one of those things
So
that
they have to get used to smiling.
well, of course they do, because for so many years they didn't smile. They trained themselves not to smile. And now here he is, he doesn't have to worry about it anymore. You think that doesn't make a difference in life? There's power in a smile.
Good.
There's power in a smile about advancements in a job. There's about relationships, about different social events, self-confidence, how you walk into a room. It's all about the smile. I don't care what anyone else says. I'm a dentist, but it's all about the smile.
Okay. And guys like this are everywhere.
Everywhere. Everywhere. And you don't know it because they're not showing it.
Was it his fear of the dentist? Do you remember it all?
I think it was his fear of the dentist.
Nobody likes going to the dentist.
I
We
think-
put everything off.
Well,
Guys do.
Of course we procrastinate. And a lot of times men will put it off until they're at the point of no return, and typically their wife's saying, you better go. And here he comes, and I can't remember if it was a fear issue or just he knew he needed help. It might have been a combination of both, but we helped him.
But he looked at you and said, when it was all done, he said, I should have done this years ago?
He was in the office the other day, and he's about 6'8", great big man.
Is that right?
And he's a big teddy bear, and when he gives you a hug, he swallows you, and he swallowed me. I mean, just big hug. He is so thankful, so grateful. Him and his wife, they're the sweetest people. He's a great guy, a great friend, and he has a great smile.
Now, we are literally out of time.
Oh, wait.
Final message.
All right. Do we have time for just one more?
Okay, one more.
I have to show this to you.
Okay.
Because this is a great patient.
All right.
This patient
About a
comes to
minute.
me. She drives over 3 hours to come to our practice. And she has periodontal disease, and she has infection down in her gums. And she's going to lose all her teeth. She's a pretty lady, right? And she wants implants. She does not want dentures.
No dentures.
She does not want dentures. So we give her a brand new smile with implants. And now look at her after picture. No infection in her mouth. Look at her eyes, look at her complexion, look at her smile. Put those up side by side. Those are absolutely drop dead gorgeous. We're changing people's lives. And don't think for a minute that those people aren't appreciative. It is life changing. She doesn't have to worry anymore. And she's the nicest lady. I mean, it is so much fun what I do because we can help people. And that's what this is all about.
And she can eat and chew whatever the heck she wants.
She can eat, she can chew, she can laugh, she can cough, sneeze, she can eat whatever she wants. You know, she can bite off corn on the cob. It doesn't matter. She's a great, I mean, she's, you talk about that. Let's talk about health. She can chew her food properly because denture wearers don't chew their food properly. Okay? So they don't chew. They don't
just kind of
chew
rub
right.
it together.
They just kind of, it all floats around in there, and they're just doing the best they can. Well, not this lady. She can chew her food properly, which gives her proper nutrition, which in theory gives her longer years on the backside.
We're out of time. Final message, though, somebody watching this, they're still skeptical or afraid of the dentist.
Well, I invite them in, and we'll go over their options with them. We'll help them out.
And they'll meet with you?
They'll meet with me face to face. They'll see me.
Well,
if they
thank you
want
for coming
to.
to the show.
Hey, thank
Very
you for
good.
having
Great
me.
energy.
Appreciate it.
Good for you. You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.